Wow, I did a lot during my PD time. From a professional development standpoint, I was interested in doing outcomes research. And so I have done a bunch of projects that are focused on sort of clinical outcomes. And then my larger project, which has really spanned the entire professional development time, is a project that is looking at fragmentation of cancer care within the state of California. And we're using two large data sets statewide and working with S-SPIRE and their biostatisticians to determine whether fragmentation does indeed affect outcomes for cancer patients and whether that's positive or in a negative way. I initially was actually interested in global health, but in the middle of my second year, which is when I would have gone out for research, COVID hit. And so all the countries were isolating, travel was difficult, and I would have wanted to do my work outside of the US. But since we couldn't travel, I had to quickly pivot. So I actually changed my sequence in terms of how I was going to complete residency. So instead of doing research after my second year, I asked if I could do it after my third year. And thankfully for that year, it worked out. And so I knew clinically I was very interested in cancer and hepatobiliary disease. And so as I did my rotations in my third year, in the first quarter, I pretty much very quickly realized that I was very interested in oncology and in hepatobiliary disease. And so at that point, I started talking to the HPB attendings here at Stanford to see if they had any opportunities for research. And they did. I mean, I had other people I'd spoken with from other departments, but I liked my mentor. I enjoyed working with him in the operating room clinically, and we had discussed potential projects. And so that was how that came together. It's actually very interesting. I did not realize at the time that my mentor, Dr. Visser, was very interested in sort of readmissions and just kind of understanding how the hospital system works and all that. And I really care about the cost of healthcare. I think getting healthcare in this country is very expensive for various reasons, and I think that there are certain cost mitigating measures that providers and healthcare systems can take. And so when we were looking at readmissions, this just sort of like fell in my lap, and I've very interested in it because I am interested in cutting costs for patients as well as for the healthcare systems. And so that's what I'm presenting on next week at a conference. Dr. Visser had mentioned that he already had funding for a research resident, and it could either be an internal resident or an external resident. And so since I was interested in working with him, we met a few times and I got funding because he had some support. But additionally, the department does have funds for residents who are unable to get external funds. And so I ended up applying for the departmental award because even though I could get funds from Dr. Visser, I think there is a component of that where they are also from the department. And so I got the departmental award, and that has funded my research for these 2 years. The leadership seminar is, I think it spans the entire 2 years of your PD time, and it's held every maybe 2 months, 6 weeks to 2 months. And honestly, I thought it would be one of those things that I wouldn't necessarily be as interested in, but I have enjoyed every single session because it's very applicable, very relevant. I think in residency, as you progress, you are given the responsibility of leading a team. So that happens by default. But that doesn't necessarily mean that most of us have the time or the interest to examine all the leadership skills out there, our default leadership styles, and when to employ various leadership styles. And so this course has been very helpful in doing all of that, right? So now I'm aware of different leadership styles and how some styles can be more applicable with certain individuals or in certain situations as opposed to others. It's also helped me to sort of be introspective about my own leadership style and decide what kind of a leader I want to be when I go back into the clinical years for my 4th and 5th year, and how I'm going to lead the teams of residents that I'll be working with, how I want to communicate with my attendings as well as other staff in the hospital. So I think that leadership course has actually been sort of instrumental or pivotal or critical for me in terms of like my future. Not even so much during research time. I actually think I can see how I can apply it in my future career. So I absolutely love it. I kind of suspected right after I had done my clinical rotations that I enjoyed reading about hepatobiliary and surgical oncology disease. It just really kind of got me excited. I was interested in answering questions within those fields. And even now during PD time, there's definitely like a bias where I'm more interested in reading literature about oncology and hepatobiliary. And so that's been great. And I think because I started research a little bit later, I would say, probably than some of my peers, and certainly than some of the people who are applying into residency these days, I always found research to be a little daunting. And I think my activation energy or my nerves around starting research projects certainly much lower. And even just starting to come up with some questions on my own and then kind of refining them with my mentor, that's been very helpful. And then PD time has also been great to help me hone in some of my biostatistician skills. I had learned a few during medical school when I'd done a master's degree, but I hadn't had a lot of opportunity to employ them. And so this time has been great because I've sort of pushed the limits of even what I learned in medical school and tried to be a bit more sophisticated with my analysis. So that's also been very wonderful. And I think in the future I could see myself sort of doing exactly what I'm doing right now. I think there's still a little bit more for me to learn, but I think fellowship will be helpful for that. I did set a goal to learn something that I hadn't mastered. And I won't say that I've mastered this, but I did dare to go on the ice and learn to ice skate. And I kind of just watched some YouTube videos and started off right on the wall and just kind of like moving slowly and to a point where I could sort of like really like move on the ice. I'm still learning to stop. So I think I have a few more months before, summer's here. And I can learn to stop on my own as opposed to relying on like friction. But yeah, so that's something cool that I did. And then obviously I think most people will travel and I've certainly done that, and I have plans to go to Alaska.